Finding the right fit, a patient's guide to therapy. Navigating the system, a patient's guide to finding the right fit. Starting therapy is a courageous and hopeful step. But the process of actually finding the right therapist or psychiatrist can feel like navigating a maze. We often treat it like dating. You won't fall in love with the first person you meet, and that's perfectly normal. Today, in the final episode of Beyond the Surface, we're sharing an essential patient's guide on how to vet professionals, what questions to ask, and what to do when the fit feels completely wrong. Part 1. You are the customer. When I first started seeking help, I felt completely powerless. My first therapist was a disaster. I was new to this, so I felt obligated to be polite, like I was bothering her with my issues. We just didn't click. Her style was too passive for my needs, and I spent sessions crying quietly while she offered soft platitudes. It made me want to quit therapy entirely. My biggest lesson? You are the customer in this relationship. Your job is to hire the right expert for your brain and your life. This is a massive financial and emotional investment, and if it doesn't feel absolutely right, it's okay. In fact, it's necessary to say goodbye and look elsewhere. That's not rejection, that's self-advocacy. The common mistake is prioritizing convenience like location or insurance over therapeutic fit. The research is clear. The relationship and trust you build with your therapist is often a more powerful predictor of success than the specific therapeutic technique they use. You need a trusted partner, the interview checklist beyond insurance. When vetting a potential therapist, schedule a brief consultation and ask these crucial questions. Modality: don't just ask about insurance, ask about their modality, the tool they primarily use. Is it cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, eye movement desensitization and reprocessing, DR, or something else? You need to know their specialized language for change. Approach: ask about their approach. Are they highly directive, giving homework and specific strategies, or more exploratory, talking about childhood and emotions? You need to find a style that motivates, not frustrates you. And perhaps most importantly, check the vibe. A good therapist should make you feel safe, seen, and validated, not judged, intimidated, or rushed. Trust your gut feeling above all else. Part 2, 2 success stories in navigation. Case study 1, the insurance roadblock. Patient profile. Clara, a 35-year-old struggling with panic disorder, had excellent insurance, but found that the 3 therapists in her network felt cold and unhelpful. She felt hopeless, believing quality care was inaccessible. Intervention. Instead of giving up, Clara calculated the cost difference and realized seeing a highly recommended out-of-network specialist for EMDR would cost her an extra $50 per session, which she could budget by cutting other non-essential spending. She made the switch. Outcome: Clara found an immediate, profound connection with the new therapist. By prioritizing fit over financial convenience, she found a modality that worked and quickly saw a significant reduction in panic attacks. The lesson: if you can manage it, never let poor fit be the end of your search. Therapeutic effectiveness is priceless. Case study 2, advocating with medication. Patient profile. Mark, a 50-year-old dealing with chronic severe depression, was prescribed his 3rd different medication by his psychiatrist, but he felt nervous about the side effects and the lack of clarity on the long-term plan. Intervention: Mark started using a symptom tracker journal, noting his mood, sleep, and specific side effects daily. During his next appointment, he presented this objective data, shifting the conversation from generalized complaints to targeted feedback. He then clearly stated, "I need to understand the mechanism of action here, and I need a clear review date to assess if this medication is worth the side effects." Outcome: the psychiatrist immediately became more collaborative, explaining the medication's chemistry and agreeing to a structured 4-week review. Mark felt respected and in control. This showed that advocating with data transforms the patient from a compliant recipient to a collaborative partner in their own treatment. Part 3, be a collaborative patient. When you go to a psychiatrist, a general practitioner, or any specialist involved in your mental health, you have to be assertive. Don't be afraid to use the word "I need." I need to know the specific side effects I should watch for. I need to understand the treatment plan and our goal for the next 3 months. My personal breakthrough came when I started using that symptom tracker. I brought data, measurable sleep quality, specific mood ratings, not just abstract feelings. That instantly changed the conversation with my doctor from passive acceptance to strategic collaboration. The goal isn't to be a difficult patient. The goal is to be a well-informed, collaborative patient, not a compliant one. That is the key to getting individualized, effective care. Conclusion: the ultimate act of self-advocacy. It can take time, disappointment, and persistence, but finding the right therapeutic fit is truly transformative. It allows you to shift from merely managing symptoms to actively building a more resilient, healthier life. Be persistent, be honest with yourself about what you need, and remember that seeking treatment, even if it means firing 3 doctors first, is not a sign of weakness. It's the ultimate act of self-advocacy. You are worth the effort, and you are worth the optimal care. And with that, we conclude our entire Beyond the Surface series. We hope these 3 episodes have armed you with the compassion to understand the internal struggle, the wisdom to support your loved ones without burning out, and the power to navigate the healthcare system successfully. We thank every brave individual who shared their story and their heart. If this series helped you, please take a moment to subscribe to Your Mental Health Matters and hit the notification bell. Sharing our channel helps us reach others who are still searching for help. Remember, your journey is valid, and you are never alone.